Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, ladies and gentlemen. Welcome to another hour of the Pannozzo Medical Show.
Good morning.
How are you, Dr. Pannozzo?
I'm good.
And there is no Les today. Les is out sick. He's been out sick for a couple of weeks. We wish him the very best and a speedy recovery. Doc, busy week. NFL today opens up. We have September 11th. We have the memorial going on in New York City. It's been going on since 6:30 this morning. For all those that were there, I was there. A lot of sentiment, a lot of feelings, a lot of stuff going on. And a lot of stuff going on in the medical arena as well. I got the chance to talk to a good new friend of mine in the medical field. He was telling me about all the stuff that's coming down with Obamacare, some of the beat up stuff that's coming, some of the unfortunate stuff that's coming. And then you have an article there that we're going to be touching on in a second. So I want you to write today's number down, 1-800-889-0267. Being that it is a sentimental day for me, if you guys call in, you'll be helping me a lot today. But there's a lot of stuff going on right now, Dr. Pannozzo, that it ain't all good. It ain't all good. So let's touch a little bit on. Why don't we start with the article that we wanted to talk about last week? We didn't get a chance.
This was in the Columbus Dispatch.
Okay.
And people still get surgeries that don't help, which is so true. We've talked about this a lot.
Mm-hmm.
And the big one here is the
Now these are surgeries around the country.
torn meniscus.
Torn meniscus. Oh, we have fun with that one.
Torn meniscus does not happen. You get a sprain of the ligament structure, the capsulitis that holds the bones together around the knee, not inside the knee. There is no problem inside the knee at all. And we treat these with just an anti-inflammatory on the place that's painful.
Right.
Because you can get a sprain there of the ligament, but it's not the cartilage. And when you take a cartilage out, you also cause a lot of defect in the structure of the knee. And if you ever see one of those, after they take the cartilage out, you can't believe the destruction that they do with this thing.
Now,
There is no meniscus tear.
Now, are they
Absolutely.
creating the meniscus? They scrape it up, or they cut it up, or they do something with it.
Yeah,
no?
they take the cartilage out, like the cartilage is the problem. It isn't, it's in the literature not to do it. And I'm telling you from personal experience, we actually treat this stuff, and there is no surgery needed on pain of the knee ever, no matter what the pain is. There is no surgery for it.
Now let's take it one step further, Doc. If somebody decides that they're going to have, and I know plenty of people who have done this, have the meniscus repaired or replaced.
Yeah, it's a euphemism for I don't know what the hell they do over there. Excuse me.
But then the bottom line is that when they destroy it worse to make it heal, is that the
They can't make
term?
it heal. It heals with scar tissue,
Right.
which is painful, and decreases your ability to use the knee.
Right.
And so in a couple of years, you're going back to getting your knee replaced.
Well, the funny thing is, I know somebody who had it done, and it didn't take, and they would not They wouldn't do anything about it. What they told her was to keep going to physical therapy, and then they injected some kind of fluid. She actually called a congressperson, and they got involved because they thought there was an unnecessary surgery.
Yes, these are unnecessary surgeries. I could tell you that from my practice was what I do. Um, no surgery of the knee is necessary, not even when they replace a knee.
So
Remember, we
they're
talked
doing
about
it
this
for a different
before.
reason.
You know, bone on bone is only about 3 inches of the knee, which is about 18 inches around.
Right,
And they're
right.
throwing the whole thing away for a little bit of scar tissue.
Which
All of that's treatable. So we treat this stuff every day.
Well, I got a doctor in a different field that came to me, told me yesterday in a meeting that we had, where doctors send patients to different doctors, and the bill rises little by little at every stop. It's like a train stop. Okay, now you got to go over here, and you got to go over here, and you got to go, and the next thing you know, the bill goes it's just astronomical, the amount of money that goes down this pike. So with what's happening with Obamacare, with all the changes that are coming, where they're asking doctors to take less and put in more hours, how's the nature of medical care going to change? What's going to happen? What do you think is going to happen?
Well, there's going to be less services and
Okay.
more people suffering. And it's under the guise of reducing costs. So when you say, I'm going to reduce costs, you start reducing costs, here, stuff that you actually need. And then you have to go back and beg for it. You got to say, well, listen, this is good stuff. You got to pay for this. And once that decision is made in some little committee in somewhere, that's it.
Now, I also heard a rumor that the pharmaceutical industry, who pumps out all of these medicines, are in on the game. So they're going to have to play ball as well. They're going to either have to lower prescription drugs, or they're going to have to change them.
I think everybody's going to take a hit because the Medicare is running out of money. You know, when you have 40% of the population on food stamps, you know there's no jobs there. What produces the tax money for Medicare? It's jobs. And if you don't have a job, you don't have a payroll, you can't pay this tax. So the other thing is they have to cut the outlay. We're already 19 trillion in debt. So they're finally getting smart. They're starting to reduce it, but they're reducing it in the wrong place. The health is not where you want to reduce it.
Exactly.
You want to reduce it in welfare payments. You want to get those people back to work. You got to stop that stuff.
Well, you got to have jobs to do that.
Age-dependent children, that costs a lot of money. You know, 15-year-olds are getting pregnant and getting on welfare. That's not fair to the rest of us that have to work.
Okay, so, and then what about the psychological aspect of, people tell you, okay, you're going to get Obamacare, but your deductible is $2,500.
Yeah, people come in my office with Obamacare, and they just say, we're not even going to use it because it's so ridiculous. The deductibles are too high. They don't pay enough. Sure, when you go to see the doctor, it's only a $5 or $10 payment copay.
Right.
There shouldn't be any copay, but that's what they do. And so usually they end up paying cash, and we just
And get it done.
give them a
Well,
bargain.
isn't it psychologically clever where you're told that you pay less in one aspect, but you're paying more in another aspect? And then he also told me that the open window now of no preset conditions, people that come in that were sick and were denied cannot be denied now. It's just raising the roof
Yeah.
on the expenditure.
Yeah, all the insurance companies are in the red on Obamacare. So like Aetna is not even doing it anymore. I think United Healthcare is. You have to read.
They can't
this
afford
stuff.
to do it anymore. Is what I
They
heard.
can't afford to give services away. It's money, and they
Right.
have to earn it to give it away, and they're not doing it. It costs too much.
And the guys here is that they don't want to be the heavy and say, listen, it isn't that we don't want to offer it to those that can't have it. We just can't afford it. And not in this particular way.
Well, what happened is those that had secure jobs and were able to have insurance, they paid for it every month. The thing is turned upside down. Those people don't have it, and the ones who never had it have it, but it's no good because
It doesn't work.
They don't. It doesn't work.
It's like having that bus pass that doesn't work.
The whole thing was a scam from day one, and I knew it then. You can't create services out of whole cloth. You got to pay for it.
It's an illusion, Doc.
It's an illusion, and that's what they sold. All the Democrats voted for that. I never forgive them for that. They should never have done that. And we're suffering from it. And then the Supreme Court passed that, and that's not, there was no reason for that.
Yeah, it wasn't even supposed to be in there, to be
They
honest.
should have said no. Go back to the drawing boards, and if you want to do it, redraw your law. But they didn't. So
I have a lot of friends that come from Italy, they live in Miami, and they're under the Obamacare, and they're all happy because in Europe, if you go to Sweden where everybody has medical coverage,
yeah,
taxes are 50%.
yeah.
So when you make $1, you got to give up 50% of that dollar to pay for this stuff across the board. There is no
These we were talking about the students.
Yeah.
These young kids in high school and college, they think there's something for nothing. They vote for this socialist baloney. There is no something for nothing. If you want that, go to Cuba.
Well, not even that, Doc. The bottom
Venezuela,
line,
those people have nothing. You know why? Because the government takes all the money. That's why.
but the bottom line is my kids call me and say, Dad, I need money for school. I need you to help me with loans. I need you to do it. I need. But what I don't understand is you're the ones that are voting for this kind of governmental doctrine that does not work.
Yeah.
It sounds great. It's a great.
It doesn't sound great.
No,
what
it
sounds
does.
great about
Not
it?
because everybody's is getting medical coverage.
It's
Everybody.
a something for nothing. You
No,
can't.
I didn't say it was great. I said it sounds great.
It doesn't sound great.
It sounds like a prayer and a miracle.
When it sounds like you're getting something for nothing, you gotta
Usually you
walk
are.
away from it. You're getting nothing for nothing is what you're getting. I mean, it's a tragic, and it's a thinking process that people have accepted that as something for nothing. And you got that Hillary doing the same thing. It's always something for nothing. We're going to give you this. We're going to give you that.
Well,
Who's
Bernie would
giving
have
you
been
what?
worse.
She can't give you anything.
She can't. Bernie would have been worse.
She has to take it from me to give it to you.
That's right.
And then
And
pretty
she
soon,
in the
pretty
courts.
soon, I'm not going to be there to pay the tax.
I know you're
And where
going
are
to
you
be
gonna
done.
get the money then?
I'm going to be stuck with your portion.
Now you got Cuba.
Well, the bottom line here, Doc, is that everybody who says that they want to give, somebody's got to pay for it. There is no free lunches, right? I mean, I can't. I've never, thank God, knock on wood, I've never been on welfare. And if I had to go on it, I probably would find a $7 an hour job just to be off it. I mean, that was my upbringing. That's the way we were brought up. My parents never did that. My parents came here with $1.25 in their pocket. But my father worked. He refused to take social remedies. But, you have these kids nowadays, the millenniums, and the Democrats are very smart. They know where to get the vote. And they get the vote, they get in power, and they do this stuff. But making a bad deal to make a deal isn't a good idea.
It's not a good idea, and it ends up being poor health because there's who's going to take care of you?
Well, let's go to the political arena. Because you can save, let's think about this. Let's be logical for 10 seconds. You can save the government a bundle of cash. A bundle. And by a bundle, I mean a huge amount because what you do is so different. They don't even have a number for it, correct?
Right.
And you can save on operation costs and follow-up care and all the other nonsense that is driving our senior society because the baby boomers are getting older. And we make up a huge amount of the deficit to take care of us. There isn't enough money to take care of us. They got to print money to take care of us. So why wouldn't the government listen? Why is it that nobody would listen to an alternative to save money?
Well, because they have new laws coming out.
Now, what do you got there, Doc?
There's a list. I haven't read it yet, but this is what the government, Medicare, is proposing. They're not supposed to do this. They're not supposed to. The way the law was written and got it passed was that they were not going to be judgmental on the billing, so everybody went for it. But then they start putting regulations in there.
Isn't that judgmental?
Yeah. Well, for instance, on the spine, which I treat all the time, they have a regulation in there that says you could do 6 shots in the back at one time for diagnostic purposes.
What kind of shots? Any kind of shots?
who knows what they mean by that? I don't do that because I diagnose before I do the shots.
Right.
They're doing it for diagnostic purposes, which is wrong. You don't do that. It's like opening some body up to see what's inside. Exploratory. You don't do that.
Not to cure somebody, you know.
Poor medicine. But they're promoting it by paying for it. Now, they pay for fusions. Hugely expensive, but I'm treating fusions all the time because of the inflammation underneath it. They shouldn't be paying for fusions. I could save them money. Physical therapy should only do a month of it, not a year. And they save a lot of money because it's ineffective. But they don't listen because a lot of it's political.
It's all political.
Yeah.
But the bottom line here is
but they're criticizing the ones who are productive.
That's right.
This is the problem.
That's right.
It reminds me of Pol Pot. Remember Pol Pot?
Yes.
He got in Cambodia, he got into power and killed all the intelligentsia. Just
It was
killed
a threat.
everybody.
He was
I mean, you
threatened.
can't believe this stuff. The ones who knew what to do, he killed them. Oh, God. So this is what's happening here. They're promoting the general practice and decreasing the specialist. The specialist is the one who knows what to do. He does it every day, on a limited area. The general practice doesn't do that, yet they want to pay them more and pay the specialist less. Pay them more. I don't care. But don't take it out on the specialist. That's not good.
Well, in order for something to work, in order for Medicare to work, in order for something to work, you got to be able to afford it. There has to be money collected or tax money put towards this deal.
Right. Well, everybody's got to make a living. I never regret anybody making a living. But you better be good at it if you're going to be successful making a living.
Well, let's take away the
But
unnecessary.
so when you have a government that says we're not going to pay for that,
Right.
they are inserting themselves. But the problem is they're not in the examining room.
No,
with
they're
you.
not. They're not.
No, they see it 2 months later and say, "Oh, well." But that's so stupid. How can you do that?
But aren't they doctors
No.
that are making these
They're not.
decisions?
No,
They're not doctors.
No.
These are non-doctors making doctor decisions.
That's right.
Okay. And then you're complaining that you want to cut back on monies and you'll pay for unnecessary surgeries.
Yeah, right.
So what if we knocked out the unnecessary surgeries and put the money towards medicine that you're doing, towards this? Educating our young medical doctors to doing it the way you do it.
Well, here's what I did. I decided to make CDs with Manx, our photographer, and teaching CDs on particular cases that the regulators don't understand that because they don't practice medicine. They're just looking at numbers. So we're doing these CDs, and I'm actually teaching them what they're supposed to know about the musculoskeletal system, especially low back. And we're sending it over there, and I don't know if they're looking at them or not, but if they do, they will be taught a great deal, and they would have a bigger understanding of what they're actually paying for.
Well, it is working because we are getting from the medical students in Boston, we are getting letters and they're asking questions.
That's so good. You have one?
Yeah, I have one. But they're being very careful of how they ask it because they're still students and they don't know if they should be asking it.
Well, they should. Especially at medical school, you ask anything you want. There's no bad question.
You should
There's
ask.
only a bad answer.
Well, you should ask because if you don't ask when you're in medical school, don't be asking when you're on me.
This is your learning time.
That's right. Wendy from Boston writes, I am a medical student at Tufts University. Good school. And just found what you're doing on your show, and she said it was amazing. I even spoke to my professors, and they said for me to take some of what you say as truth, some of what you say. And the rest, you have to make up your own mind, meaning that she has to determine what she thinks about what you're saying.
I would fire those professors right then and there.
Well, I think that
is stupid. That is a stupid answer for a professor.
I think that they are.
I've been a professor.
I think they're trying to be politically correct.
Oh my God, I can't stand it. These are colleagues of mine. They have the same degree I have, and I can criticize them.
Yes, you can.
Yes, I can.
As it is, she has a hurt elbow from lifting heavy boxes when she was moving, and she went to the doctor, and they said ice compression, hot releases. Plus an anti-inflammatory. That's how they're treating this.
A non-steroidal anti-inflammatory.
Yes.
Everybody's against steroids. It's dumb.
Non-steroidal.
It's the best thing you have for
Well, people run away from the word steroid. You know that, right?
What?
People run away from the word steroid.
I know. It's they're. I
That's
guess
because of the weightlifters.
this is what they read or something.
It's the weightlifters.
Yeah.
They get small conchitas.
Yeah, well, steroid is a big class. There's anti-inflammatory,
right? Yeah.
the kind we use, but they're all
Education,
in the steroid class.
education.
It's
Yeah,
a
no, I
chemical
understand.
class.
I
It's
understand. No, I know because I spoke
yeah,
to you for 3 years.
but the audience doesn't know.
And people say, "What does he use? A steroid?" Oh no! Oh my God! And they melt in their chair. I got to bring them back to life with a spoon.
Oh my God! I mean,
So
they
she's.
got to trust the doctor. I mean,
Well, that's the. Well, we're trying
see,
to build.
Physicians aren't going to use anything on you that's suspect like that.
Well, you're known on Federal Highway now. That's where I was yesterday, getting all worked out.
I'm known on Federal
They know
Highway.
all about you. The
Who?
doctors on Federal Highway. There's a whole row of doctors down Federal. Did you know that?
Oh,
Yeah. Look, when you drive down, look at all the different clinics and hospitals. And most of them know Dr. Pannozzo now. They know you doesn't mean they love you, but
No.
they know you. They don't love you, doc.
there's a lot of competition.
But there's competition with doctors anyway.
Hey, that's great. I always love competition.
There's nothing wrong
You
with
know
a
why I love
competition.
competition? Because I'm smart enough to win.
Well, what you do, nobody does.
You just have to analyze it and think about it properly in a scientific manner and relate it to the anatomy, and you got yourself a winner.
You got a better fastball, doc.
Good.
So anyway, so she's in pain, and she says to me, "Can you tell me what the pain above the elbow that runs to her shoulder means, and whether or not your procedure is a better procedure than the one they gave her to remove the pain?"
Well, first you have to be diagnosed properly. There's only two things in the elbow that could be. One is muscular, and that's when you have to drop things. Your grip is gone. And the other one is you can't straighten it up.
Two different problems.
So two different problems.
I had that one with the straightening out.
Right, two different tissues.
Right.
And they're treated differently. The muscular part, you have to chase it because it starts in many areas and ends up as a tendon. So you have to chase that. It's all superficial though. The ligament one, we use a fluoroscope and to actually see it inside, and then put an anti-inflammatory steroid in there, and then it comes right out. 1-day treatment. There's nothing to it.
Well, tell
Now,
me.
if it goes up to the shoulder,
Right.
she
That's what
probably
she
has.
said.
She has a shoulder part.
So it's not the elbow at all.
Well, maybe
Could be
not.
the shoulder.
Could be just a refer.
But you know how you're gonna. Wendy, if you're watching and you want to call in 1-800-889-0267, the 800 number you can call in, but you're gonna turn her world upside down because it's not the elbow.
Well, if she calls me on Facebook, if she has the phone, and shows me, we can do it her exam at her school, so doesn't lose class time.
Right.
I could diagnose her over the phone and or with FaceTime. It's FaceTime.
FaceTime.
iPhone.
Listen, she calls, I
Yeah.
get her on the air. But the
Yeah, we
amazing thing, Doc, the reason I like this question, and I've known you long enough, and I was hoping that this is the answer I was going to get. They're wrapping her elbow. It might not even be the elbow.
No, we don't wrap anything.
But it might not be the elbow, Doc.
Actually, mobilization of the painful structure does help, but not wrapping it.
But think about this.
Oh, it's crazy.
They're looking at the elbow, and let's say the pain's in the shoulder. That's ridiculous.
But see, she's going to a professor in the medical school who
Because
doesn't know what he's talking about.
Because she's a medical student.
Ah,
Now, if I'm a medical student, let's change the gears here a little bit. I'm a medical student, and I've been taught what she's been taught, looking in the wrong places. Now, how do you explain it to me? Now, what do I spend to go to medical school, Doc, a year? $250,000?
oh, I don't know, if not that much.
100,000?
Well, with living, it could be under that.
Okay, let's say it's $80,000 a year. I think it's more, but let's say it's that. And I'm a medical student, and I'm paying to be taught compression and decompression and release. I'm paying somebody to teach me this now. Mind that. And along I meet you, and they are wrapping my elbow. I go see you. You fix my shoulder. Pain goes away. What am I supposed to do, Doc? As a medical student, what do I do?
You get out of the school, get your degree, and then learn what to do.
How can I get out of the school? I'm already in it.
No, I mean graduate.
Oh, you graduate.
Yeah, graduate, get your degree. I did that to my son, Paul. He was in school, and he would learn these techniques that I was developing, and they wouldn't let him do them.
So you got to wait till you're out of
And
school
never asked me about it.
and
They
get your
just-
license?
So I said, look, just get out of school, get your degrees, and then I'll teach you all this, which is what
Which
we
is
did.
what he does now.
Yeah, right.
Well, that's very unique. So if you're a medical student, you're listening to the show, or watching the show on Pannozzo.tv, which you can see all these shows, give Dr. Pannozzo a call, and he'll be more than happy to bring you in and sort of, I guess, educate.
Sure, no problem at all.
And you don't have a problem doing that.
Pardon?
You wouldn't have a problem taking in somebody who's graduated from medical school and
No.
developing
not
well, there you have it. 1-800-889-0267. Is that the number here? What's the number here, Connecticut? 889-0267, right? 889-0267? Yeah, that'll work.
It used to be up on the board there.
I know. People take it down so that I can't remember stuff. All right. Let's kick another question. Ray from Boston writes, I watched your show last week, and that was a very good show we did last week, by the way. You really hit a nerve with a lot of coaches I told you about during the week. But politically, the parents have to approve kids to come in to see you, so that takes a little bit of time. We're working on that right now. And what's happening is there are a lot of players that don't play well to one side or the other, and it's beginning to become common knowledge that what you found on me with the hip situation creates a big imbalance in running and fielding and everything else. But he watched the show last week and was impressed to learn that using your procedure one can tell quickly if he has bad hips by just how he does things like hitting or fielding. We just said that. My son plays college baseball and has been told that he has a hip flexor, Doc. You know what a hip flexor is?
Yep.
And that's a common injury in sports.
It's not too common, but it does happen a lot.
Well, they've changed the name, but hip flexor is what they used to call it in the day. Now you have strains and stuff like that. And he's landed on the disabled list. That's the DL. Can something be done to help that situation?
Yeah, it's a one-day treatment for that. And Les had that. Remember, Les talks about it all
The
the
groin
time.
point.
The groin
groin
pull.
pull.
But it was a hip flexor tendon.
Yes.
And it's a one-day treatment. That's
Well,
all it is.
they say
one day and playing the next day.
Well, he says 4 weeks.
Yeah, 4 weeks. That's-
Anti-inflammatory.
Because those doctors don't understand what they're talking about. They're surgeons. You understand? Musculoskeletal medicine is not surgery.
Well, the father doesn't want the son taking drugs. So the
Well, the father ought to
anti-inflammatories.
get a life because you don't interfere with the doctor and the patient. You know, if he wants to practice medicine, let him practice it then. Don't bring him in. You know, I mean,
No, but
I'm so sick and tired of the ignorance out there.
No, but he's saying he doesn't want him taking the anti-inflammatories.
Well,
and he
have
doesn't
him
want
treat it the way he wants to.
He
then.
doesn't want him sitting on the bench for 4 weeks. So his question to
Oh.
you, he's saying the opposite. He's saying to you,
Oh,
he doesn't want him doing that stuff. He doesn't want him taking anti-inflammatories. He doesn't want him waiting 4 weeks. The question that he has is, once you cure the area, once that spot is gone,
yeah.
can he resume playing
Yeah, it's the next
within
day.
a week? Next day.
Next day.
Which I think he is dumbfounded to again, people up in Boston, you audience.
They should not be afraid of pretty good medicine. I mean, we're practicing A1 medicine here. There is no downside to it at all.
No.
Take advantage of it. If you want to get well, come in, get it done, and don't worry about it.
Now,
I do all the worry for you, and it's completely above board, safe, and very scientific, and reproducible, which is what you want.
Now you had a pitcher that came in. Was he high school or college?
High school,
And they told him he was going to be sidelined for a while.
6 months.
And
You
6
know what
months.
happens in 6 months?
Yeah, you can get married and stop playing ball. But
You lose your range of motion.
That's
You
right.
can't do it after that.
now let me ask you a question. Where was his injury?
It was in the ligament structure.
In the
front.
shoulder?
Yeah.
And I saw the pictures. I saw the film work of him moving
Right.
in a pitcher's motion.
Now that wasn't scripted. He
No,
walked
not at
out
all.
of the treatment room,
His father was shocked.
and it was about 22 feet
Yeah.
that he had to walk from the treatment room. And he was standing there with his dad, and he was moving his arm up and down. He couldn't do that. And the father was dumbfounded. He didn't know what to
He
say.
didn't know what to do. Neither one. What do we do now? What happens now?
I say, listen, let the expert take care of these things. Don't worry about it.
Have you heard from him?
No.
Okay.
We tried to call him, but he never answered.
Amazing. Amazing. Now, was he going to go back to practice or talk to the coaches? Or
Well,
what?
I told him just go pitch tomorrow. That's you're okay. Go ahead and do it.
I would have told him, listen, do me a favor. Take a catcher on the sidelines and pitch.
You see right.
Because if you go to the coach, you know what's going to
Well,
happen.
the coach could have called me and said, "Is he ready?" And
Did
I
he
would've
call
said
you?
Yes, but they don't call you.
They don't call you.
You know, they seem to know so much.
They
that
don't.
If you're an expert, they consider themselves, I don't know, well, maybe they don't know enough to talk to you, or maybe they know too much. I don't know. It's one of those.
Well, I don't know what kind of pitcher he was to begin with. I mean, if
Yeah,
he's throwing the ball and hitting the cow in the pasture, and he did that before he got injured, I don't want that to be the excuse. Oh, look, he's still hurt. That's why he's throwing the ball away.
Well, you know, there's a problem with that age group. You have to understand what their motivation is. If the parents want you to get a scholarship and you develop a pain, you don't want that pain removed because you don't want to do that. Now that we see that all the time.
Well, this parent looked like he wanted
But
it
a
removed.
real athlete, when they come in, they want everything. They give it to me now, and we do it, and they go back to playing. So the opinion of the patient
Right.
counts, and you have to talk to them. You got to find out what their motivation is, either get well or not. So we had a girl like that with an elbow,
I remember this.
and the father called me next day. She refused everything, so
She didn't want to play.
she didn't want to play. The father called me next day and said, "You are right. She doesn't want to play, and we're not going to bother with this."
Well, you know, but that in itself is healing somebody. You shouldn't force anybody to play.
Well, she's going to be sorry later because the object is to get well, and
That's
then
right.
don't play. Who cares about that? But
That's right.
you know, your future does not always depend on having a pain or not. Just get rid of the pain, then you can make a decision.
That's right. And what you want to do is you want to be able to stay in the game if you want to stay in the game.
You got to do that.
But I also was curious to find out if he was an active, good player, if his mechanics. You know, I'm more into the mechanics. I want to know what his mechanics look like after, because you develop some strange habits when you're in pain, and all of a sudden your mechanics go.
Well, the thing about it is, though, the way I approach it is, we have to know what the normal anatomy is. I don't care how wrong you've been.
Right.
I'm going to give you a normal anatomy,
Right.
and then you can start from zero and
Well, I like
get
to
better after that.
I like to pick it up after you because I know that success rate is going to be how people will judge at the beginning.
Right.
You know, if you're an athlete, if you are, you know, a waitress and you can serve food again, that's a different animal. But as an athlete,
Well, you never want to change your
that's right.
your method of delivery of that ball, especially
correct.
the pitcher. You want that to be a normal shoulder. You don't want to compromise your delivery.
That's right.
Because when you do that, you're going to get hurt again, and your future is very dim.
Well, that's what happens with people that come along, have you do surgery, and work on the
There you
new
go.
delivery because of the surgery.
Yeah, and you can't do it. The golfers, especially, should never be operated because it changes their swing. Scar tissue does not act like normal tissue. So, when you have a lot of scar tissue, you have lost your swing. You can't change it. You got to get it back to normal.
You know, it's really strange. I've spoken to you for over 3 years about this, and every time I talk and I think about injuries or I think about players that I've had over the years,
Yeah.
and I said, man, if I knew Dr. Pannozzo, I would have gone about this all.
Yeah, you've said that a lot.
Wow, but the more I think about Tommy John surgery, Doc, okay, which you and I still are trying to figure out what they're doing. What the hell are they doing? Removing tendons and ligaments and what you have.
It's
in there.
stupid. There's nothing there. We treat that with a shot. And they're treating it with huge surgery that eliminates them from playing for a year. I mean, the whole thing is bizarre. This is a bizarre thing. If you know the anatomy, you don't do that.
What about removing the rib?
Nothing to do. Oh, that's even worse.
What is that? I mean, what?
It's
How
old
do you do
treatment of
that?
50 years ago.
But why? It doesn't work.
Well, because
Nobody's ever come back from that
I
injury.
know, because there's a scoliosis between the shoulder blades causing that.
They're not even looking in the right place.
They don't even look in the right place. You're correct.
That is very, very disturbing.
Right.
I don't mind you messing up diagnosis, but when you're not looking in the right place, Doc, it drives less crazy when we have this conversation. All right. Daryl from Boston, another one from Boston. Remember, new crowd, same questions because they've never seen it before.
Sure.
Writes, I just started watching the show for the last couple of weeks and have knee pain, which could mean anything. The doctor told me that it's because of my flat feet and no support in my arches make my knee hurt. He's a construction worker, so I guess he's lifting on top of those flat feet. I know what that's like. And he's had pain for a long time. Can you tell me if your procedure will help me with my pain?
Sure.
Now, when you work on him, will you be working on his flat feet as well?
Well, we diagnose him from the low back down. It's all one unit. I look at it as one unit. And so the problem could be anywhere in there.
Now, what is it? Why is it that people even have flat feet, Doc?
Well, there's a ligament that holds your foot up there. It's called a talocalcaneal ligament. So when you sprain that on the inside, it holds your arch up. So when you sprain that and it lets go, you lose your arch.
But I never had an arch.
The toe goes like this.
But I never had an arch. I don't have that titanium stuff you're talking about. I never had it. I've always been on flat feet.
No, it's not. It's not titanium. It's
no, I know. Whatever you call it. What was the name?
Talocalcaneal ligament.
That sounds like titanium to me, right? Now, I was a catcher, so I ended up putting all that pressure for 18 years on my feet with flat feet.
Right.
The damage that I cause is tremendous, isn't
Well, it's only ligamentous and it's all treatable.
But it hurts like the dick
Yeah,
is.
it hurts. That's why you get it treated.
But it is treatable.
Yeah, so where is all this pain coming from that people talk about? What is the structure that does it?
What do you mean? The tiny
Tissue. The tissue that causes all the pain
the scar
everywhere.
tissue?
It's scar tissue of what? Ligament.
Of the
ligament.
Yeah.
Ligament.
Oh, everything's in a ligament.
For the medical student, it's all ligaments.
Even that what is it? Titanium. Talocalcanium stuff.
First of all, you have to realize that there's a bone in the foot that's called the calcaneus.
Did you know that, Doc?
Yeah, it's a talocalcaneal
Look at
ligament.
this. You got a nurse over here.
This is more specific.
It's in my blood. Medicine's in my blood, unfortunately. Yeah.
Did you know you could sprain that calcaneus?
Yes, I actually did.
And you didn't tell me nothing.
Well, you didn't ask.
No, that's not well known. I gave you a fact that is not known.
Wow. So when you sprain that, you destroy it and your feet become flat?
It stretches out.
Stretches out.
And your foot becomes flat because the thing goes like this, your arch goes down, and your big toe goes over to the side.
It goes to the side. Wow, this is craziness. Yeah. My goodness gracious.
All correctable. Just raise the arch. That's all you got to do.
And how do you do that, Doc? Well, that's not. If you want to know how to do that, you got to come and see Dr. Pannozzo. How's that? Right. And we're not going to give out your number because they'll start calling you. But you can call in 1-800-889-0267.
Yeah, call up. There's nobody on there.
If you got any flat feet problems, give us a call. And then he's asking, again, you have to pardon, he doesn't know. Is there anyone in Boston that does what you do?
No.
No. Smitty from New York City writes, I had shoulder surgery a year ago. This reminds me of Manx. And they fixed a torn ligament by replacing it.
With what?
Another ligament from another part of the body. Or they could use a cadaver or cadavis, whatever it's called. Cadavis. The shoulder took almost 4 weeks to get into a usable state, so I guess they had it slung. And my shoulder is still in pain. Still in pain.
Yes.
They want me to go see
That's a normal
another
thing.
surgeon.
Yeah, okay.
As I may need another surgery to fix the surgery they used to fix the shoulder.
No, the first surgeon didn't know what to do, so he needs cover. So he sends you to someone else who examines it and tells you in couch terms what to do, which is physical therapy.
So he's going to have a second surgery to fix the first surgery.
Yeah.
And they're never going to say that the first surgery was
No.
done incorrectly.
No.
They're going to scrape his bone like they did with Manx.
No surgery should be done on the shoulder. It's too simple. I mean, if you understand the construction, and that for the medical student, I hope they're listening, you need to know the construction of what you're talking about. If it's a shoulder, you have to know how it's made, what it's supposed to do, what are the components of it. And you'll find out how simple it is. No surgery is ever necessary on the shoulder.
Well, he says he can't lift his arm above,
Well, it might be a supraspinatus tendon. There's a tendon that goes to the bone. And
Doc is hitting me with the
and
words
all you do
today.
is
Holy smokes.
is treat it.
Super duper
And it
what?
comes right up. It's no problem.
There you have it, Smitty. There you have it. It might be something very simple. Don't have another surgery.
Our shoulder treatments take about 10 minutes, and they are 100% effective.
And the shoulder surgeries that are performed in this country.
I know, it's just crazy.
Outrageous.
This is what I'm telling Medicare. Don't pay for things that are dumb.
No, they won't pay you the small fee.
No, they'll pay the big fee. Yeah.
And still get no help. Smitty's going in for a second surgery. I mean, come on. This is just ridiculous.
Well, if I was Smitty, I'd just fly down and get analyzed and fly back
That's right. Save the money
next day.
for the surgery and come down.
Doesn't cost that much.
But save the money on the surgery.
Yeah, right. Yeah.
And come down here and fly back. You can stay for a weekend.
I'd like to see
Pannozzo.
a lot of the surgical suites closed.
I think that if they're not, if cases like this, I can't argue.
I mean, they're billing the government extraordinary amounts of money because
They throw it on insurance.
they have high price nurses running in and out. They have all the stuff that they do. I mean, it's just it's like I think of it as a ritual, like some kind of religious thing.
Well, when you have an issue, throw it into the insurance. Okay.
Yeah.
Scary stuff, though. Oh, I don't feel good. Anyway, Victoria from New York City writes,
You don't feel.
because it really bothers me. I mean, all kidding aside, I mean, we have a little fun with it and what have you, but it really bothers me that people want to have medical coverage. They'll take anything. Okay, so you don't pay anything for it. But then you're going to pay for it one way or the other. And, one day it'll be all surgery.
Look, all I know is that before Obamacare, there was good insurance, low deductibles, everybody had it. They covered everything. Obama comes along with his ideas, and the Democrats passed it, and now you got the whole thing is stupid, and it's in an uproar. They're trying to save money here, trying to save money there. I mean,
They're broke.
And they're broke.
The system doesn't have any money.
And they don't create jobs.
No,
So who's paying the taxes? Nobody.
It's crazy. Well, I don't know.
If you don't pay the taxes, where's the money coming from to pay out?
And then
I mean, this is 101
medical
economics.
Listen, didn't they have a problem with the IRS under the Obama administration? Wasn't there a problem with the IRS? Too many audits, illegal audits, and stuff like that.
Yeah, if you were a conservative group, that you didn't get a license to be a nonprofit.
So all of a sudden, because they need more money, they started to do more audits. So here we go again. Here we go again.
It's a bad thing when the government acts that way, because the population who supports them, they are supposed to support, become the victim. And if you look at it like that, if they're auditing you and the taxes are so high, you are now a victim. You don't own the government anymore. They're taking it away from you. There is a clique that owns the government, and they are the ones who pass the rules, and they take all your money. Pretty soon you don't have any money left.
Yeah,
And now I'll tell you, go to Cuba. You want to see how it goes?
Stop saying yes
Go
to Cuba.
there.
They don't have nothing going on there. Take it easy.
They have nothing going on there.
Did you see the first plane that landed in Cuba? They whistled to the tower. It says, "Can you remove the truck out of the runway, please?"
You're kidding.
Swear to God, it was a true
You're
story.
kidding.
You got to remove the truck. We can't land with the truck on the runway. So they had to send somebody out that was snoozing, and he went and he moved the truck.
Wow.
And you sending me to Cuba. Okay, Victoria from New York City writes, I saw a commercial for lower back pain, and after suffering for 4 years of getting out of bed and trying to tie my shoes, I went to see them. This is about the clinic I talked to you about when I'm going to remain nameless. I watched your show where you say MRI does nothing to help with seeing the pain.
Right.
But they use an MRI to explain to me how surgery was needed to fix a bulging disc in my lower back. This is a true story. It would mean that I had to be bedridden for 4 weeks and no guarantee that it would work. Can you give me some advice? Now, this is going back to the story we talked about. That's over $1.5 million in commercials talking about this clinic. They're doing 140
It's a slick
surgeries.
commercial, what you're talking about. Very
Well,
slick.
it's very nice.
Very nice with the music and everything. And it's just wrong. You cannot diagnose anything from an MRI except a tumor.
And they're showing a doctor talking to somebody,
right. And
going like that with
it
the
is
pen.
really false because I treat backache every day, and you can't use an MRI. It doesn't tell you enough.
Can it tell you
You
enough?
have to have an examination. You got to know pain patterns. You got to know how to examine someone, and then how to repeat the exam to see if you improved. And I've seen the failures of this company in my office, and
Right.
we took care of them.
They come to see you.
Yeah, sure.
Wow. Now the funny thing here is that they make it sound like lower back pain is inexpensive to fix. Their way.
It is my way.
Their way it is.
No, it isn't.
I mean, 4 weeks no pay, or you got to take 4 weeks vacation or something on your job. Your job continues, right? And then you got to go to physical therapy, and then there's no guarantee that the back pain will be dismissed.
Yeah, we're the only ones that guarantee that.
Now,
Yeah, so when you call up without insurance, like that group you're talking about, I tell them this is what it costs, but it's a guaranteed result. In other words, you're not going to have any more pain. We
Right.
do whatever it takes for this amount of money. That is a real bargain,
of course it is.
and they're charging $15,000
To start,
to start. You don't even know if you're going to improve or not.
you never know if you're going to tie your shoes. Now, David Wright had stenosis, shrinking of the spinal column. And then after
No,
a-
that's a misread.
okay, but after a year of changing his game and the way he walked, it was really funny. Then he said that he had a herniated disc in the top of his neck, which needed to be operated on.
Yeah, those surgeons will go all out to get work, won't they?
No, but they didn't want to admit that maybe they had messed up the first diagnosis. He's out of baseball. So my question to you is, you go to this clinic and they give you an MRI, and they allegedly tell you that you have a bulging disc. Same thing with Neil Walker, which now the Mets are saying maybe he didn't need the surgery.
See, bulging disc doesn't mean anything.
What does that mean?
It doesn't mean anything.
What
I
are they
treat backaches every day, and it doesn't mean a thing.
and what are they surgically removing?
I don't know. It's all a ligament, and they're all very small. I don't know if you can see me, but it's that big and that wide. That's all you got.
But a bulging disc, they say bulges. What's the bulge?
Well, if it bulges, because it's subluxed that way.
What's
So
that
the bone slid into another bone, which causes a ligament bulge.
So how do you get
So
it
you
off?
open the joint up. That's all.
So how do you do that?
Yeah, I do it by shot.
They do it by surgery.
They do it by surgery.
They
which you
they
don't want.
hand move it. Is that what you're talking
Well,
about?
I don't know if they're doing it right or not. I don't know if they're actually doing what I just suggested we do. This is what I do because I understand the physiology of pain production. What is the cause? Where is the pain, and why is it there? You have to understand that. You do not get that from an MRI. You
Okay,
get that from
all right, hold on a second.
First of all, you got to know where your pain is, so you got to take a history. Then you have to know about the examination. You got to be able to examine for it and write it down, which means something. Everything that you do in my office means something. Means some anatomical structure. The history, the clinical exam, everything we do is geared to narrow that down to one structure.
Okay, hold on a sec. I got a question.
Okay.
Can an X-ray show a bulging disc?
No.
Is there any way of seeing a bulging disc on the spinal column?
Well, they claim they see it with an MRI, but
But it doesn't show what it is.
No,
It just shows the
doesn't show.
bulge.
It doesn't show that's the one that's doing it, even causing you the pain.
So they may be looking again in
Don't
the wrong
forget
place.
the ligament structure around the annulus, which we're having a discussion now with Medicare because they don't understand the annulus. It's a ligament that holds the bones together. That's all.
Yeah, but they don't know what that means.
But it's able to move around like this. That's how you can be a jumper. You can do flip flops. You can hit the ball. Anything you do makes the annulus turn. And but if you have a scar tissue there,
It won't turn.
and you turn, now you have a pain. Okay, so it's still an annular pain. It'll cause you pain in the leg or something. So you have to understand the pain pattern, where it's from. These are not nerves. These are only ligaments. And if you know how to take the pressure off of a ligament, then you could do that, and you get a great result.
So a surgeon that
So, and we do this in one day.
No,
Believe me, one
but
day.
this
no
is
treatments.
But look at the difference between what you can do in one day. If I have a bulging disc,
Yeah.
and you go in there and you relieve the pressures, I guess what you're trying to explain. Yes? and it goes back in place because you relieved it?
Yeah, we relieve the stress on the ligament.
Okay. And it goes back in place. And in
Yes.
a couple of days, I'll give let's say a couple of days, there should be no pain whatsoever.
It's gone the same day.
It goes right into place?
Does not come back.
This is strange. So Neil Walker's sitting in a hospital bed right now. He's going to be out for the season. We need
Well,
to hit.
you wonder why. If I was an owner and I was paying millions of dollars out, I'd be looking high and low to find someone to fix this guy.
Yeah, it
But
makes
they're
no
not.
sense.
No, they leave it to the surgeon. They leave it to the trainer. Like they know. They don't know anything about this.
If I work in an office and I have a bulging disc and I can't go to work, I come see you. I'm back to work Monday.
You are.
I mean, this is it's just crazy way of thinking.
Right.
I don't. Strange. Strange.
Well, it's
Okay.
a matter of training. They're not trained, so they know what they know. That's it. But it's when I was trying to learn how to do this, I didn't go to the guy who didn't know. I went to the books. I found out what I'm supposed to know. I didn't listen to some guy telling
Yeah,
me
but you
anything.
stumbled on something like ringing ears and.
Oh, the ringing of the ears. Oh, that's great.
But
It's 100
you've stumbled on removing stuff that has been plaguing mankind forever.
Right.
Hey Doc, you remember how they used to treat acne with X-rays, X-ray machine,
No kidding.
Did you know that?
No.
and then they found out it was giving cancer of the thyroid. Did you know that? True story.
There's.
I found that out yesterday.
Wow. I mean, I'd never known about that treatment.
I mean, think about it. They
I
used to
wouldn't have
use
done that.
X-rays for acne, and it works because it kills everything, including your thyroid. So there you have it. I mean, it's just again, I'm just flabbergasted. All right, now this next letter that we got is from a friend of mine who watched your show in New York City, Johnny Olan. Johnny from New York City writes, I deliver soda for Pepsi. He's a Pepsi soda delivery guy on the big trucks. For 20 years now, he's been doing this. And my lower back and my knees and my hips, again, everything from the waist down is all messed up. Now, he works for Pepsi, so they send him to their doctors. And the doctors told him that he needs surgery to replace the meniscus in his knees. And we just talked about that.
No.
And I told Johnny, I said, listen in today, watch this show, don't have it done, bring the family there. You can stay in my house if you want, Johnny, and let the good doctor see you, and you'll take care of that meniscus problem.
Oh,
for him on
in a
both
minute.
knees. On both knees.
In a minute.
All right, and it was really nice to get a friendly letter. What do we got left? A few minutes, okay. Sandra from Atlanta writes, I watched your show on your website and saw how you can cure migraines.
Yes.
Her question is, she understands how you remove the pain, but is it true that the pain never returns?
It does not come back. No.
And she wants to know, because she doesn't believe in coincidences, how migraines are affected from the same area on every person.
Yeah, because it's one particular joint. That's not all headache now. You can get headache from the neck from various sources, but migraine is a particular headache, which is right here. I don't know if you can't see me, but
I see, right
it's
behind
right
your
there,
ear.
right above the ear, and only that one. That one we could take out, and it does not come back.
And the great thing about the way you do the migraine piece is that sometimes there are other accompanying factors to migraine. Like sensitivity to light. And
Oh, none of that is true. Absolutely not. There's no basis for it. There's no scientific
Nobody's
basis
ever come
for
to you and
any
tell
of
you
that. Well, they tell me
They-
that, but there's no
but-
basis for it.
But when you remove the migraine, then they become normal again.
Yeah, they're normal.
So I'm going to take credit for it, Doc. Why not? Annie from Atlanta writes, I was shocked to hear that you found a cure to ringing in the ears.
Yeah.
I was more surprised that the ringing in the ears happens not in the ear, but the neck area. It seems
That's
like
right.
today people have been looking in the wrong area for a lot of stuff, Doc.
Well, the ENT guys never change. I mean, they taught me that 50 years ago, and it's the same, and they don't change anything.
He says,
I don't understand it. I wish they'd call me up. I showed them how to do it. Maybe they could do it.
he says no one's ever told him the ringing in the ear was from a different area besides the ears.
Yeah.
And he wants to know, has the ringing ever come back? Have you treated anybody
No,
they come
they
back?
don't come back. No.
Okay, so they don't come back. Strange. That's a strange diagnosis. the
I
ringing in
think
the ear.
when I stumbled on this, let me tell you something. It was like Hosanna. I mean, there's a huge market out there. These people are suffering from I mean, I have people in there that suffer with this 20 years.
Of course.
And we take it out in 2 days.
Doc, they're moving the crystals. Do you know that you put
That makes me laugh.
they gave me when I was a kid hydrogen peroxide to clean my ears, which works. It does work, but they use it for ringing in the ears.
They can't use it for ringing in the ears.
It's not in the ear.
Because it's not in the ear. Plus, there's a closed system, your ear canal. There's a canal there, and it goes to your membrane that you hear with.
It's crazy.
So it's a closed system. And when they do that, it's bubbling out.
It's bubbling out.
takes a wax.
The wax
away.
out.
Yeah, it takes a wax out.
Doc, show's over. But you know something? I think we covered a lot of ground today. If your doctor is not helping you, he's probably looking in the wrong place.
Yep, gotta calm me down.
Don't go to a plumber when you need an electrician. I think that's the best.
That's exactly right.
Right?
That's what I tell people.
You call in a plumber when you need an electrician.
If you're going to a surgeon, you're going to get surgery. What do you think you're doing? I mean, don't go to a surgeon and expect him to do something else. He's going to operate you. That's what he does.
That's right. Make your second opinion your first. Visit Dr. Pannozzo. His office number is 561-381-5800.
Yes, we guarantee all the treatments, and nobody else will do that, but I will.
That's
I guarantee. When I offer you something, I'm guaranteeing that it works. And if it takes 1 or 2 or 3 days, I mean, whatever it takes, you get that.
That's right. 561-381-5800. Doc.
Well, thank you.
It's always a pleasure.
Thanh you very
Got
much.
educated today. I learned a lot of stuff, especially some new words.
Tato Calcane.
That's right. You're going to be joining us on Two Boys from Brooklyn during the week?
Yeah.
Call in if you're not too busy.
Yeah.
All right. Connecticut, as always, thank you. Ladies and gentlemen, we'll see you next week. Visit Dr. Pannozzo. Get his app on Pannozzo.tv. Download the app at your download store for any phone, any gadget. And we'll see you next week, Doc.
Hey, bye.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.
Stream this report live on our iHeartRadio app.
Happy Sunday. I'm meteorologist Felicia Combs. Isolated